And with that, I'm already in the middle of the event. And this event is called Meet the Experts with an S. So it's a plural because we have not only one expert, we have actually 3 experts for you this afternoon. And about the first experts, I'm very happy about 2 things. So the thing number 1 is that he's still awake because currently it's in the middle of the night for him in the Midwest. And the second thing is I'm especially happy because this is Clayton Johnson. And Dr. Clayton Johnson has been a guest of our Meet the Expert podcast series. He's a graduate of the University of Illinois and incredibly, but 13 years of experience in both large swine operation and large veterinary clinic practice. And currently he's a partner and owner of the veterinarian and cartridge veterinary service in Illinois, the Illinois, USA. And Clayton, you have published close to 13 papers, both abstracts and peer-reviewed. So you maintain your scientific career while you are really giving practical advice and try to improve pig health in the barn. And just very recently, let me congratulate again to your practice award that you gained at the Lehman 2020 Science Conference. And Clayton, you do have a very challenging task currently, because in the next 20 minutes, you will try to deliver a very practical knowledge about sow herd stabilization. If you, if members of our audience, friends in the audience want to address specific questions, please include them here in the Q&A section down below in your screen. And later on, after the 3 presentations, we will collect all the different questions and then can address them specifically to the speakers. And with this introduction, Clayton, I'm very much looking forward for your presentation.
Very good. Thank you very much, Dr. Marius. That was really a very appreciated introduction. Okay, well, let's talk about stabilizing our breeder herds for PRRS. You will probably think at the end of this presentation, what Clayton shared sounds very simple. The concepts do not sound complex, and you are correct. Management of PRRS is not necessarily, it doesn't have to be a very difficult topic to understand. The discipline required to execute these strategies can be hard to adopt, however. So if you take nothing home from this presentation, please understand that the concepts that we try to apply are very simple, but that does not make them easy to execute. It requires tremendous discipline to go through this approach, because management of PRRS at the breeder level and stabilizing PRRS is really a months-long project typically. So let's start with a quiz to get everybody in the audience engaged. I have a quiz question here, and it really talks about breeder herd PRRS stabilization. So breeder herd PRRS stabilization is defined as one of these 4 options. No clinical signs of PRRS in the breeder herd is option number 1. 4 weeks in a row of negative processing fluids for PRRS PCR is option 2. Greater than 270 days following the breeder herd outbreak is option 3. And then option 4 would be no vertical transmission, no sow to piglet transmission of wild type PRRS virus. What does breeder herd stabilization mean to you? Which of those answers best represents breeder herd stabilization? All right, it looks like we have our results, and the majority of our attendees have selected no vertical transmission of wild type PRRS virus. Excellent. That gives us a wonderful starting point, because that would have been my answer as well. No clinical signs of PRRS in the breeder herd does not mean we have a stable herd necessarily, okay? That's a good start, but that does not mean that our downstream pigs won't struggle with PRRS. Same thing with 4 weeks in a row of negative processing fluids. It's a good start, but I can give you many examples, unfortunately, of after that 4th week, you may again have positive processing fluids with wild type virus. And the same thing with 270 days following an outbreak. We used to use that as our standard for stabilization. We have learned that some viruses can survive within a herd for longer than that, unfortunately. So we do require those diagnostic tests, and we'll talk about what specific tests I would recommend. So let's get back into the slides. Let's talk about stabilization in the sow herd, and really let me start with a story of why that's so important. As Dr. Marius said, I've been a practicing veterinarian for 13 years, but I really have grown up in pig production. It's the only jobs I've ever had in my life, starting as labor on pig farms as a kid to my current position as a veterinarian. And as a veterinarian, I was really fortunate to start my career with a wonderful production company called the Mash-Offs. This company was about 100,000 sow level and owned all the growing pigs all the way to market when I started. And we grew rapidly over my 8 years there, and we're about 225,000 sows when I left. My first job was focused on wean to finish. So I was responsible for the health of a big part of the growing pigs for the entire company. I was responsible for about 750,000 market pigs, for the health of those pigs. That was my first job. And I worked with some extremely experienced production folks. I have some pictures here of people that were wonderful mentors to me, people that have been named Masters of Swine by the National Hog Farmer. And their kind of first feedback to me was, you know, as we have grown, we feel like we've lost some of our production expertise. We feel like our production numbers suggest that maybe we aren't as good of caretakers at our big size as we were at our small size. And they asked me to investigate this. And I think it's kind of a common suggestion or a common root cause that people assume that, you know, you've got a lot of gray hair, that the new people that are coming in, maybe they just don't care or they just don't know, right? And I would tell you that I wanted to investigate that, but I also wanted to investigate maybe some root causes that had nothing to do with the training level of our caretakers or, you know, the capabilities of our people to take care of the pigs. So I went through a good mortality review. I did site visits, I did diagnostics. I talked to the production teams. I talked to the contract growers in the system. And really, I came to understand that the entire region did not have a mortality problem. We had specific flows, specific groups of growing pigs that came from specific breeder herds that were our problem. And really, the PRRS status of the sow farm dictated, was that flow a problem for us, or was that flow not a problem for us? Certainly, we had variation in both in PRRS negative sow farm performance and in PRRS positive sow farm performance. And the sow farms themselves all had good performance, even the PRRS positive ones. They didn't necessarily have any clinical signs of PRRS, but they were transmitting PRRS virus to their growing pigs. When I explain our production system to people, I would always talk about, you know, we had animals of different health status like all production systems. We had our boar studs at the very top, and, you know, we had our multiplication farms, our GDUs, and then we had our commercial level of production. We really only saw PRRS in the commercial level of production. So up in the genetic level of our production system, we had very good biosecurity and good locations, and we didn't struggle with PRRS. But when PRRS would come into our commercial sow farms, that was really where it caused problems in our commercial breeder herds. Because as soon as our breeder herds were infected, we knew that the downstream production, the growing pigs, whether they were in wean to market facilities or nurseries or finishers, they were going to be infected with PRRS. And likely for that flow, for the next year, we were going to have to deal with it. For at least 6 months, we would produce PRRS positive wean pigs. And then for another 6 months after that, we were still feeding the last of those PRRS positive wean pigs out. So PRRS would typically cause problems by coming into our breeding herds and then persisting in our growing pig populations simply because our breeder herds kept transmitting it to our wean pigs. Our historical PRRS management program for our breeder herds was to receive gilts from an outside multiplier into a dedicated GDU for that PRRS positive breeder herd. And we would use live virus inoculation to expose the gilts to the specific strain that was at that breeder herd. Now, if the sow farms were PRRS naive, they would obviously receive PRRS naive gilts. But for those PRRS positive breeder herd, we ran specific gilt flows with live virus inoculation that matched the wild type viruses at that breeder herd. And that sounds wonderful conceptually, but you realize then that, well, unless we have those gilts completely PRRS virus eliminated by the time they come to the breeder herd, they may end up transmitting this virus downstream to our wean to finish facilities. The lessons learned we got from that was that some of those gilt developer lots will never quiet down. They will never completely clear the PRRS virus in time for their introduction into the sow farm as a select weight gilt. And those PRRS impacts in those growing pigs were expensive. Oftentimes in a situation where we saw no clinical signs at the breeder herd, we would not have PRRS issues in that flow of growing pigs early in their life. During the nursery period, maybe we did not see big challenges, but it was in the finishing stage where the pigs would lose their maternal antibodies, but the virus was still there. And the pigs would go through an infection, either in kind of the middle age or sometimes even the later ages of their growing period. And we have so much feed invested in those pigs at that point that we would lose pigs that were extremely expensive to lose. Our cost of production was already heavily incurred in the pigs we were seeing the mortality on. And as crazy as it sounds, you can afford to lose a lot more pigs early in life than you can later in life. Wean to finish mortality can be a tricky number. The cost of wean to finish mortality can be higher in a group that has or can be lower in a group that has higher mortality, believe it or not. So we really, if we have to have a PRRS challenge, it's better to have it early from an economic standpoint and lose those pigs. When we were having those PRRS challenges late, they were extremely expensive challenges to happen. And we really felt that it was all because of the gilt live virus exposure that we would have these downstream PRRS challenges. So we modified our gilt development program. We certainly kept the multiplication level PRRS naive. We continued to ship PRRS naive gilts to the PRRS naive sow farms. But for our PRRS positive sow farms, for the ones that historically had PRRS challenges, we maintained the antibody status with vaccine going forward, using modified live vaccine to our gilts. And you notice we removed this gilt developer specific PRRS exposure program. Because we were now using modified live vaccine, we felt comfortable raising these gilts up as PRRS naive gilts, still entering them into the commercial breeder herd as a PRRS naive gilt, but vaccinating them with PRRS MLV as soon as they were received into the breeder herd. Okay. We also found that that allowed us to commingle our PRRS stable sources. When we had a PRRS stable sow farm, commercial breeder herd, we could commingle them because we did not have to worry about the difference in wild type viruses amongst those herds. In the previous model, if I had a PRRS positive sow farm, I had to flow those pigs independently. This program gave us more flexibility to commingle pigs that were not wild type positive, but just vaccine virus exposed, okay? We could take them from the sow farms where we use the vaccine virus to maintain antibody status, commingle them to even further lower our cost of production by reducing our housing costs. When you commingle pigs, you fill barns faster. And when you fill barns faster, you market barns faster. So you would get more production throughput through what are often contract production facilities. What did we learn from that program? We really felt like it was much more sustainable than LVI. We felt like our gilts grew much better now that we weren't exposing them to wild type PRRS virus. And we had better predictability of those gilt weights. So we would enter them into the sow farm at the right weights to breed them, okay? We had some concerns, to be frank with you early on, that maybe our immunity with just MLV virus wasn't going to be as good as our immunity with LVI. Maybe we wouldn't see the protection that we had with LVI, and we had some concern. And so we decided to monitor that. But I would tell you that has not been a concern for us for quite some time. This graph really reflects why we are comfortable with the level of immunity the vaccine provides to us, and really don't think it is inferior at all to the level of immunity that live virus exposure provides to us. This chart is a little bit busy, so let me set it up. The y-axis represents the percentage of weekly wean pig volume compared to historical. The x-axis is weeks post-outbreak for herds undergoing a common wild-type PRRS virus outbreak. Okay, so the y-axis is the percentage of pigs that you wean relative to baseline, and the x-axis is the PRRS outbreak timeline, with week 1 being the first week where we realized that we had PRRS on the sow farm. Okay, and this is wean pig volume, so it's specific to the sow farm. All right, and it looks at 6 different herds that broke with a common strain of PRRS virus. So we sequenced this PRRS virus and we found that it was the same strain that moved through multiple farms. And this is a 174 cut pattern of PRRS virus. And I know the RFLP patterns or the cut patterns aren't necessarily predictive of cost protection. And I don't mean to suggest that, but I simply use this as a naming mechanism. It was the same PRRS virus, and all these PRRS viruses, you would hear them today described as lineage 1. That would be the buzzword you would hear associated with these viruses. And if you've heard any of this, buzzword discussion on lineage 1, you'll hear that some of our MLV vaccines are not lineage 1 derived PRRS viruses, and suggestions that the cross protection can't be good because the MLV viruses were originated from different lineage. Okay, again, we were concerned about that. But if you look at this chart, and you look at our sow farms that were just vaccinated. So the green line is the stage 2, or what we call PRRS stage 2 sow farms, meaning they were vaccinated prior to the outbreak. They were antibody positive, but only with vaccine virus. And you look at the red line, which is our PRRS naive herds that broke with the same virus. You can see that the PRRS naive herds were decimated by this virus, going down to 20% of their weekly wean volume of where they historically have been. And not to suggest that with our vaccinated herds that they got away with absolutely no performance challenges, okay? That would be silly. We don't have a perfect solution for PRRS today, but we do have good solutions. We have best available tools. And I would suggest that the vaccine is our best available tool to create antibodies in our sow herd today while not having to deal with downstream wild type PRRS challenges that originate from vertical transmission, from sow to pig transmission. So what take homes can you take from this? I think number 1, appreciate that the value of PRRS acclimation is significant. And certainly if you can eradicate wild type PRRS and you can stay PRRS naive without future outbreaks, you should do so, okay? However, if you're one of the many, many, many breeder herds in the world that can eradicate wild type PRRS and can get, a year, 2 years, maybe even 3 years without a new infection, but maybe eventually the area PRRS pressure is going to get you and you will have a new PRRS outbreak, then the vaccine is for you, okay? The protection is for you because the protection is real and the cost of the vaccine is absolutely justified if you are going to have a PRRS break on any sort of a frequent basis. Even if you can't do live virus exposure, there still is value in acclimation. So how do we stabilize our breeder herds? This is going to sound simple, but again, it requires tremendous discipline to stick to. Load, close, and homogenize. You'll occasionally hear load, close, and expose. I would tell you it's the exact same concept. So the load period, we want to put as many gilts into the PRRS unstable sow farm as possible, okay? We want to load up that sow farm, all right? Get as many gilts in there as we can because we are going to close the herd to new gilt introductions. No new animals will come into the herd during herd closure. And this is the tough part. This is where producers always say, oh, but my breeds, I need my gilts for breeds. Well, we're going to put as many gilts as we can in to try and help with the breeds, okay? But then we have to close the herd. That's how we get rid of the wild type transmission. No new animal introductions for the virus to circulate in. We need the virus to burn out. The wild type virus has to burn out in all of our animals before we resume the introduction of gilts. And the homogenization is with mass vaccination with the PRRS MLV vaccine, and we do that twice, 30 days apart. Some producers may use an LVI, live virus inoculation, as part of the homogenization. If producers really stick on that, I don't really argue with them, okay? I use the vaccine as well, okay? If I'm going to do the live virus inoculation, I'll stick it in between my 2 vaccinations of PRRS MLV, perhaps. I don't let that be a huge sticking point for me, but I do really push producers to use vaccination as part of it, because we are often not eliminating all of the PRRS antibodies on the farm. We're going to maintain the vaccine long-term. So I want to get the farm starting to use that vaccine and use the vaccine to help clear the wild type virus from the farm. We'll use McRebel-like strategies. And I always, when I say McRebel, use the air quotes to kind of suggest that I don't think McRebel is a well-defined term. And I shouldn't say that. It is a well-defined term, but the way we use the term today does not match the original definition that Monty McCaw gave to McRebel many years ago, okay? McRebel today suggests farrowing house restrictions meant to minimize the risk of lateral disease introduction and farrowing. We really want to facilitate disease elimination as soon as the in utero transmission of PRRS stops. So as soon as pigs are no longer born PRRS positive, we really hope it's only 3 to 4 weeks before we have our entire breeder herd PRRS stable, okay? We just need to wean the positive pigs out of the farrowing house. And as long as there's no pig-to-pig transmission in the farrowing house, we have eliminated PRRS virus at that point. Sanitation is critical, and certainly sanitation around the wean process is extremely critical, all right? I can't emphasize enough. You really need to focus in on the weaning event. The hallways have to be cleaned immediately after weaning. Our workers need to be cleaned immediately after weaning. Those wean pigs are very high risk to prolong that PRRS transmission from pig to pig. And the weaning event is always such a big deal with so many of the farm staff involved, and it's impossible to do without getting ourselves and our hallway and our equipment heavily contaminated. So we need to plan and have time to clean ourselves and our equipment up. So to get you guys thinking again about PRRS management, I put some poll together here with a question on McRebel and farrowing house restrictions. So if we can pull the poll up here, we'll let the audience vote on what do you think the definition of McRebel farrowing house restrictions would be. What are some examples here of McRebel restrictions? Is cross fostering to teat count, but no other pig movements? Is that the definition of McRebel? Is changing gloves and needles and scalpel blades at processing? Is that a component of McRebel? How about wearing disposable aprons when we process the pigs? Some way to try and prevent contamination of our workers' clothes and those sorts of things. You know, using just one apron per litter and ripping off that disposable apron after my litter is processed and moving to another one. Is that one? How about no fallback litters or no rollback litters at weaning time? Does that mean McRebel to you? And then certainly all of the above. You know, do you think all of these fit within the McRebel category? What's McRebel mean to you? Which one of these answers do you think best describes it?
Clayton, would you quickly explain what aprons are?
Oh, yes. So an apron is an external piece of clothing that you would wear over your shirt and over, say, the top half of your pants. We classically would think of aprons as something that we would wear while we prepare food. Maybe you are making some bread or some pasta, and you don't want to get the flour all over you. So we would put the apron on to cover our clothes. And the disposable aprons are plastic aprons that are very thin. So they are not the most sturdy things in the world, but we will only wear them for one litter at a time. So we only need to wear them for maybe 10 minutes while we process the litter. Then we rip them off and go to the next litter. Excellent. Dr. Marius, we may have the experts on the wrong end of this presentation because they have questions. All the above is a wonderful answer. And for those of you who selected individual answers, but not all the above, you are correct. What you selected is a very important part of McRebel, but I would tell you that each of these in our modern definition of McRebel is critical. All right, so let's get back in the slides here. So how do we know the breeder herd is stabilized? We've gone through the load, close, and expose. How do I know that I've won the battle, that I've stabilized my breeder herd? We will typically start with processing fluids. Processing fluids are the fluids that remain from tails and testicles after we allow those tails and testicles to sit for a short period of time, maybe an hour or two, okay? And we will typically collect them using the process you see on this screen here. And I share this with courtesy of Will Lopez from Iowa State, who was really one of the early pioneers of processing fluids. You can see we take some sort of a container. We've got a trash can here, but I see oftentimes farms will just cut the tops off of maybe a disinfectant bottle or something that they have access to. And then we put a trash bag, some sort of unscented trash bag liner, or maybe like a Ziploc bag liner. Then we place cheesecloth as well on top of that liner. And as we process the pigs, we take our tails and testicles and we set those into this trash bag or bucket or whatever our container is. And once we are done processing for the day, we remove the cheesecloth and we give that cheesecloth a good squeeze. Okay, not enough to rip the bag open, but enough to express some of the liquid from the tails and testicles. And then that liquid from the tails and testicles becomes our sample type. And we submit that to the diagnostic lab for PRRS PCR. It's a wonderful way to sample hundreds of pigs with one PCR test. If we bleed pigs, we pull by 5. So one PCR test is 5 pigs. With this, we can amplify our sensitivity greatly because we are testing many, many pigs in the population. We use that to determine when in utero transmission has stopped. When we're looking at the wean pigs, we try to look at a different population type test. And we've gone towards family oral fluids in recent years. And family oral fluids are the same concept as a regular oral fluid we think of in growing pigs, where we hang a rope and they chew on it, and the saliva we can squeeze from that rope becomes our sample type for the PRRS PCR. We find that these baby pigs, when you just provide them a rope, they don't know what to do with it, okay? But if we just hang the rope kind of on the side of the crate where only the baby pigs can get to it, they don't know how to chew on it and you can't get a sample. But if you put the rope in an area like you see on the picture on the right where the sow can chew on it, now the baby pigs will learn from the sow that, okay, this rope is to chew on, and they will go chew on it and you'll have a much higher success rate to be able to test those pigs. We can use that to infer our wean pig status, and certainly that's the most important status for declaring victory for PRRS elimination. So testing recommendations, I always suggest producers start with processing fluids, and we'll typically start somewhere around 12 to 16 weeks after the herd closure has started. Okay, so we don't do the processing fluids the entire time. We know they'll be positive early on in the closure, so we'll wait 12 to 16 weeks before we start collecting the processing fluids and testing them. We'll do all pigs processed that week, and we'll pool all of that sample into one PCR. So that's a lot of pigs, okay? But early on, we're just looking to get a negative test or two to suggest that we have mostly negative results. Then we'll transition to one processing fluid PCR for room processed. So we'll do the PCR by room instead of by week to try and increase that sensitivity level, all right? Less pigs on the processing fluid pooling will result in a little more sensitivity. You can feel comfortable up to about 35 litters of pigs. So at 35 litters, even if there's one positive pig, we should catch it with the PCR on 35 litters. But past 35 litters, admittedly, you may miss one individual pig if that pig doesn't have a very low CT value by itself. We'll do the processing fluids until they are negative for 8 consecutive weeks. Okay. okay? And then we move on to our family oral fluids, and we'll collect 20 liters per week there with 1 PCR per liter, okay? So that one is a little bit more expensive than the processing fluids. And really we'll declare victory once we have 8 consecutive weeks of negative on the processing fluids and 4 consecutive weeks negative on the family oral fluids. So 12 total weeks in a row of no detection of PRRS. Now, with that, I appreciate the opportunity. I want to thank Dr. Marius and the entire BI team. I want to be respectful of time, so I'll turn it back over here.